Health Canada has approved Moderna's COVID vaccine, and it's welcome news for most northern parts of our country. The territories are expected to get a greater portion of the doses on a per capita basis, and that's because it can be stored at regular freezer temperatures, making shipments to remote communities easier. For more on this, we've reached Caroline Cochrane. She is the Premier of the Northwest Territories and joins me now from Yellowknife. Premier, welcome to the show.
Good afternoon, David.
So,
nice to be here.
Thank you for making the time. Major General Danny Fortin, he said today that pending any weather issues, the first doses should arrive in the territories on December 28th. Are you ready for them to show up?
It is one of the best holiday season gifts that we could get.
So what exactly do you need to do to get ready to accept delivery? So where are you in your preparation to get those needles in people's arms?
Well, we have large freezers already in place in Yellowknife and N.W.T. We will be using portable freezers to distribute to the smaller communities. But we're not doing this alone. We can't do it alone. So we don't have the infrastructure, the road systems. A lot will have to be flown in because of the winter season. So we're going to be using the federal government, the Joint Task Force, North Task Force, to help us with the delivery, and also working with our Indigenous governments and municipal governments, our partners, to make sure that as many people as possible can get vaccinated.
So will you be relying on private carriers, for example, to get the vaccine doses to the more isolated parts, or will you rely on the armed forces? How exactly is that going to work?
Well, those are part of the planning stage that we're doing now. So I know there is some legislation around transporting vaccines. So our health department is just finalizing up the plans. January, and then right after that, soon after that, we'll be starting to vaccinate people.
Okay, we know there's 168,000 doses coming in the first shipment, but that's for all of Canada. Do you know exactly how many doses the Northwest Territories are going to get?
The first shipment will bring us 7,200 doses, which will vaccinate 3,600 people. So we'll be using that with the most vulnerable people, of course, as we move forward.
So when you say the most vulnerable, you're talking people in long-term care settings, you're talking remote, even extra remote and extra isolated communities. I mean, how will you pick your priorities in the Northwest Territories?
Well, we're working with the guidelines from the Public Health Agency of Canada, identifying, of course, those who are elderly, over 60, those who are higher risk, and those in our healthcare fields and our small Indigenous communities. So we will be focusing probably on these smaller communities to begin with. They don't have the infrastructure, they don't have the health centers. If COVID-19 hits there and hits community spread, and we've been very fortunate to date that we haven't had any community spread, knock on wood. But those are our most vulnerable populations. So we'll be focusing our first doses on the smaller communities.
I know there are transportation and capacity issues in the north. This is arriving in the middle of winter. So how does that complicate things? What would be the biggest challenge in your region?
Well, I think we've been planning for this for quite a while. So the rollout of such a mass vaccination right across Canada is going to be a challenge, of course. But we had a very successful flu vaccination season. People in the Northwest Territories, we recognize our vulnerabilities. And the residents, I can't say enough, have stepped up. And the flu vaccinations that we did this fall was astounding. I also want to say that a huge thank you to our healthcare professionals. Since the beginning of COVID-19, many people have not stopped working. People have given up their own lives for those of the residents, and can't say enough to support them and say thank you to them all.
When I spoke with your colleague Sandy Silver, the Premier of Yukon, about a week ago now, he said that the goal is to have about 75% of the adult population across the territories vaccinated by the end of March. Do you have a sense of how quickly you can get to 100% vaccination? Because it seems that there's a prioritization happening with the North with these Moderna doses. Do you know when you might get to 100%?
Well, 100% would be a gift in itself. 70% gives us herd immunity, which means that less people are able to transfer the illness. However, there is a population that does not believe in immunizations. There's a population that does not believe COVID-19 exists. Mm-hmm. And there's also a population within Indigenous people, because we have been used in history for horrible tests. So there's also a population that believes they don't want to be used as guinea pigs. So we have our own work to do. A huge education component will be coming with the releasing of the vaccinations, so that people understand this is not COVID-19 is real. People need to be vaccinated, if not for themselves, for those around them. And the more people that we can vaccinate, the safer we will be as a population. So that is the message we'll be carrying forward into the new year.
But how do you build that trust with the Indigenous populations in particular around the issues that you just outlined, right? Based on historical mistreatment and the skepticism that would be naturally there. I mean, that seems like a fairly big hurdle. How do you get over that one?
Well, we've been meeting with the Indigenous governments, our partners here, throughout the pandemic, usually on a weekly basis throughout it. So I've emphasized to them that this is not about using us as trials. This is about recognition from the federal government that the Indigenous communities are more vulnerable, showing lots of research shows just the basic standards of living that some of the communities in the South are living in, and their access to healthcare, which affects us as well. So I've been talking to them about that. I've been saying that it's not only the federal government, it's all three territorial premiers have been lobbying hard for the vaccinations as well, recognizing that we're very vulnerable. We don't have the healthcare capacity to deal with an outbreak. Nunavut showed that. So it's a matter of talking with leaders, being willing to stand up to the plate. When my time comes to be vaccinated, I'll be the first in line to make sure of that. And I've been asking our Indigenous leaders as well to stand beside me. Some of the best is role modeling.
Just one final question before I let you go. Only one active case, I think, in the Northwest Territories right now. I know there's a huge concern here about people getting together over the holidays and that contributing to transmission. Do you have any anxiety about that, given your low caseload? Are you asking people to stay home, or are they free to move around and socialize at Christmas?
We've been very fortunate in the Northwest Territories. We were the first jurisdiction to actually lock down, provide isolation centers, request people, stop people from traveling into the territories when the pandemic broke out. So we've been fortunate because we've been tight from the beginning that we're not having to lock down as tight as some people. We are, this is our biggest risk period. People are tired of the pandemic. People are hopeful for the vaccine. We're worried that more family gathering, we're very tight and very close in the north, will bring a community spread. So we've been spreading the message as much as possible. Enjoy your time. Keep your bubble small. You're allowed 5 people into your family other than your family networks. Wear your mask in public. Keep your social distancing. Wash your hands frequently. Mm-hmm. It's not the time to let go now. We're almost there.
Okay. Premier Cochrane, thank you so much for your time, and good luck with the vaccine rollout.
Thank you. It's exciting news and good news for the whole of Canada.
Oh, indeed. All right. Thank you so much.
Thank you. Have a great day.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.